All right, let's begin the COVID-19 session for the unofficial guide. And there should probably be a 20-second lag on the live, so that should be fine. And once it catches up, the video should update itself. All right, we're going to be discussing the COVID-19 for, oops, we need to cancel out the timer. All right. This session will be for the COVID-19 overview, symptoms, and whatsoever we need to discuss, including the home remedies. Just a disclaimer, anyone who is going through COVID or is to treat medical treatment, this is not to be used as your medical advice. You need to consult with your doctor and get your prescriptions with them and discuss any herbal medication or any other thing that is ever recommended to you. So do not just start taking anything without consulting with your doctor. Your doctor will be able to identify what is happening, what are the symptoms that they need to look for, and the treatments they need to recommend. And if your body is good for herbals, they will go ahead. If not, they will be the better judge to let you know. What we will be discussing here is strictly what we had done when we had gone through it, what was used, and what worked for our family members who were infected with COVID and how the recoveries went for it. Now, just for the overview, actually we'll just go through the site and go straight to the COVID website. To get to the website, you can either go to the unofficialguide.ca and then click on the COVID link, which will bring you to a website that looks like this, and then click on more info for the main web page, which we will discuss in a bit. This will be an overview site where you have just an overview. All the details will be under the unofficialguide.ca/COVID-19, all small letters, no caps. Once you are here, you're going to get all the detailed information on COVID, how we COVID as, and what we identified for ourselves as, and what treatments were used. So for us, focused on COVID as it being a vasculotropic, meaning impacting blood vessels virus. So our name classification would be VTCOV19 instead of SARS-CoV-19. Now, the impacts are throughout the body that we understood, and it is throughout different organs, different locations in the body, surface, within organs, skin, a lot of places. Everyone can go through the information, what the ACE2 receptors and all that was known for. Now, as for what we are, from our perspective, dealing and focused and treating it for is, as mentioned, vasculotropic, and we are still making it CoV-19. What impacts SARS-CoV, which means you're anything to do with severe acute respiratory syndrome, would be impacting vessels in the lungs and the inflammation caused and the reactions whatsoever the syndrome is. Now, the actual impact is on the vessels. Now, that is the main reason why we are not going to be sticking with SARS. Anyhow, so let's go with the symptoms. What are most common ones that people had gone through would be fever, shivering if someone has organs or enough damage that needs the body to trigger a fever as a response. Now, for the most toughest and the most complicated one was the gastrointestinal one. Um, we will come to that as well. However, we will go through in step by step on every single symptom and the treatments that were used. Um, Also, if you are tested negative and you still have symptoms, consult with your doctor. There might be a possibility that the test was not, the test did not catch it. So consult with your local or whoever the family doctor is and take it from there. Identification, fever, sore throat, skin diseases, we will go through all those probably in a different detailed session, but this we'll try to keep it within 15-20 minutes. Um, yes, there is organ failure linked to a lot of cases as well. Mainly blood clots would be the brain ones we will go through as well. Smell and taste, one of the pretty, yeah, not so good ones. Pain in the veins, mainly for the active people or the active lifestyles where the damage was there, and they went through thinking that they have recovered, and as soon as they were active again, whatever the active parts were, they had pain in the veins, apparently, as per what was described. Gastrointestinal, it is very complex because we really have no idea. It has to be the doctor who will tell where, which part of the whole system is infected. So a lot of tests, they probably will know which exact treatment you need to do. Because you'll have one spectrum where you have constipation, one spectrum where you will have diarrhea. So best to consult with the doctor. Now, impacts on human body. First, the lungs, because that is the most common in and out air to blood vessel channel in our body. Kidneys, it is impacting a lot as well. This happen, you get to know after the blood tests and your urine test and a few more tests. Heart, yes, we do have people who were using heart medication on schedule and people who are using blood thinner medication on schedule, even if they were positive, tested positive, they showed very least symptoms. Some did show fever, and some did not show anything at all, even though they were tested positive. And yes, these are all within our family as well, and as also from people we directly had known. Again, blood vessel is throughout the whole body, depending on if it is within the organ part or under the skin. It is again a different treatment for that. The doctor will be able to confirm what it is and where it is and what needs to be done. Skin, a lot of it is to do or has to do with the vitamin deficiency or the ability for the skin to regen of in the same sequence as it should have after the infection, but after the infection, it just cannot stop the infection and it spreads. The infection spreads. Mainly in kids, there is the herbal treatment as well for that. That also the doctor is best to confirm that should or not be used. All right, this would be the first page for the symptoms, isolation and quarantine, or sorry, isolation versus quarantine. We just had to put up whatever was available through the web application. We did not or and did not want to get into writing it ourselves. So once someone goes there, they can get that from the links provided. Um, Healthcare worker guide, everyone would be getting from their own provider. And we just had an overall quick guide for places where they are either not able to or they need a quick guideline how to make up their own. So this would be a helping guide for companies or people who want to either um, have a self-education program for their own employees or within families. This can also be, there are a lot more on the internet. Please go through all of them and check what works best for you. These are the things that we came up with after removing what was not necessary and would fit almost every family and every company. Now let's go to the treatment section. Again, when we go here, we will also discuss prior to going there is discuss your symptoms with your doctors, get your tests done, get your blood test, whatever is required for by the doctor, then recommend or suggest whatever you have for the herbal treatments if it fits you or not. Um, for us, what has worked, these are all described in the ratios, and everything is within a daily intake of any household. If they're making food at home, South Asian especially, or if they have spicy spectrum of food they like, these things would basically already be in the diet. What you need to do is figure out if your body is good to take them as a herbal treatment or as a tonic or in a saturated form. That is what you definitely need to discuss with your doctor. They will go through a dietary plan with you. You'll have to discuss it with your dietitian. Once it is all approved, then you have to discuss with them these are the things that you have looked into. And once you do, then only go for what you decide. What we have done is instead of just giving the treatments what worked for us, and mainly these treatments are not from any, these are mainly through herbal, what would you call them, tonics. However, you still have to figure out if your body is capable of taking them or not in this saturation, even if you are able to take them in diet. Sometimes you are on this diet and you don't know what's happening with your gastrointestinal system, and something is something is enough, and you may have to control your diet, especially garlic. Not everyone should be taking garlic if they have diarrhea. Diarrhea is literally poison if you look at how it impacts your system, especially if you have the diarrhea ongoing impacted by COVID. Now, all the ingredients are explained at the bottom, what the active contents are, why have they been used before, what research has been done, interactions with other medications, all of that is available as a reference, and everyone should do their own research before trying anything out. That is by default. So we did put in the articles that are done by uh, research institutes, whatsoever they were. Other than that, all the ingredients are explained with their chemical compositions and mostly what their interactions were. For treatments, we have the lung aspect, the kidney, skin, heart, blood vessel, gastro, hormones, sensory, sore throat, and the other one I think we have missing, or I don't know what's happening with that. When we get into that, I think let's figure that out. All right, we'll just discuss one, which is the gastrointestinal one. Bananas and yogurts are your friends, though that's probably what you are going to end up being able to eat at that time, anyways. But discuss this with your doctor. Not everyone should be taking it. If they do recommend or allow, go for it. This again, discuss it with your doctor. Imodium. Uh, this also, a lot of people discuss what drink are you taking. Don't just start taking any electrolyte drink and think that it's going to do the job. Exactly discuss what you're taking and let your doctor know what your body weight. They're going to discuss everything with you and what your loss is and all that stuff. Definitely avoid garlic. And if you keep taking garlic and if the stomach keeps getting flushed and if it keeps going on, if you are going to the washroom more than 20 times a day, yes, that happens in the cases. That is what's going to happen. You are going to have to call 911. So that is why this is one of the most critical ones after the lungs. All right. So go through the ingredients. 1/8 teaspoon black seed oil, teaspoon 1/4 cumin powder, quarter teaspoon ginger paste. Ginger paste you can have in just paste fresh ginger and put it in the freezer. We did put it in the freezer in small chunks, quarter teaspoon chunks, and then just ginger and garlic. If you can use garlic, just freeze them up, the paste. Turmeric powder, try to get the organic. Uh, if you are using organic, you can probably put it to 1/8 because organic is strong. Black seed powder, 1/4, 1 tablespoon black forest honey. Black forest honey is what we also need to explain why. Black forest honey is a specific honey. Not every honey will do the job. The reason why black forest honey is used is for the enzymes that are taken from the plant, eaten up by an insect, excreted by the insect, taken in by a bee, refined by the bee as human consumable honey. Just to get that enzyme, we have to tap into the nature and figure out where you're getting the black forest honey and use that. So that enzyme is what we need to use. 90% of the times it should not impact your stomach. If it does, then there is something more to your stomach. So just do a quick test. Take a little bit of a honey before you take the whole paste. If it impacts or has a crampy feeling in your stomach, consult with your doctor. Something more is going on and the damage is a little further. Now, warm water, not hot, because you are to keep those enzymes alive. Usually, the coffee maker water temperature after a minute or two is pretty good. So once all of the stuff is mixed up in a tonic fashion, you will just put water in it and try to take it as soon as you can. Recovery rates are pretty good with us, almost 100%. and go through all the symptoms with your doctors, pick exactly what is it that you need. And also another thing for skin, a lot of stuff with kids definitely works is the black seed oil if they're getting rashes on the skin. Um, Apply generously on the skin on the impacted area. You may not even need to, usually by the time the damage is done, sorry, by the time you see the signs, the damage is already done. So you may not even take black seed oil under the tongue, but if it is spreading and it is out of control and if it's in multiple places, then yes, consult with the doctor. And this is what you would be doing on the skin. Clean the impacted area with dish soap. We just try to not use petroleum products because we do not have any evidence of it actually helping. Yes, petroleum products are discussed on both spectrums, yes or no's. We don't need to get into it. We don't see any benefit to it. We tried it. There was no significant benefit compared to anything else. So we are not using them. Now, just apply the black sea oil on the impacted area and wash whenever you need to wash it out. Usually within 7 to 8 hours, the infection stops spreading, and within 12 to 48 hours, you see the decrease. Within 3 days, we usually have almost only signs or the patches left. Within a week, the skin clears it out. Very effective, and discuss it with your doctor before you try anything because every condition is different. That should be it. And that is all about the unofficial guide COVID section. Glad to be able to do it within, how long did it take? We shall figure that out. Probably no timing on this line. All right, that's about it. 25 minutes most probably. And we shall see you guys soon.